Canines. Canines are the teeth which are said to be the cornerstones of the dental arches, since they are the teeth which are usually seen at the corner of the mouth, and they are positioned between the anteriors and the posterior teeth. So they are said to be the cornerstones of the teeth, and they are usually 4 in number in the entire oral cavity, 2 in the upper arch and 2 in the lower arch. They are said to be the third teeth from that of the middle line, and they closely resemble both of the upper and the lower canines. Both of them, they closely resemble each other in structure as well as in function. And these are the teeth which are said to be the longest teeth within the entire oral cavity, in the crown as well as in the length form. And the major function of the canines is that they form a canine guidance because of the form and position of the teeth, and other than that, they also are said to be the canine emissions, because since the structure, the position, as well as along with that, the position, they resemble that of the teeth with cervical portions over the roots on the within, and they provide anchorage since they are presented deeply within the bone. All of them together, they are said to be the canine emissions with the resemblance with that of the ascetic form. And they are said to be they have a self-cleansing activity because of the shape of the crown of the canine tooth. And the other function of this canine tooth is that they provide support. They support the incisors as well as the premolars. Since they are placed in between these group of teeth, they provide proper support to both the groups of teeth. So this is in brief about the canines. Coming to in detail about the maxillary canines. These maxillary canines, they usually seen the first evidence of calcification is 4 to 5 months of age, and they are usually enamel is completed in 6 to 7 years of age. They start erupting at 11 to 12 years of age, and the root is completely formed by 13 to 15 years of age. Coming to the dimensions of the canine, maxillary canine, the length of the crown is 10 mm, the root length it is 17 mm, and the mesiodistal diameter of the crown, it is 7.5, at the cervix it is 5.5, whereas the labiolingual diameter of the crown, it is 8, and at the cervix it is 7. Coming to the cervical line of curvature, mesial side it is 2.5, whereas at the distal side it is 1.5. Coming to the labial aspect of the crown as well as the root, they appear to be narrow mesiodistally than when compared to that of the maxillary central incisors. Since the crown structure starts tapering from that of the incisal aspect towards the entire length of the crown, this appears to be having a narrow mesiodistal dimension. Mesially, we find that it appears to be convex starting from the cervical region towards the mesial contact area, and the contact area is usually at the junction of the middle as well as at the incisal third of the crown. And coming to the distal aspect from the buccal view, from distal outline from the buccal aspect, we find it appears the concave area starting from the between the cervical line towards the distal contact area, and this distal contact area is in between the middle thirds of the crown. And the cusp of this maxillary canine, it is usually has a two slopes, mesial slope and distal slope. Mesial slope is shorter, whereas distal slope is longer, and the slope has a tendency towards concavity, that is, it forms a depression which are usually developmental in origin. And other than that, next we find when we approach towards the cervical line, it appears convex, and this convex has a concavity towards the root portion. The labial surface of the maxillary canine, it is mesially and distally shows shallow depressions, and these depressions result in labial lobe formation. Coming to the root from the buccal aspect, the maxillary canine appears to show a slender form of a root, since the mesiodistal dimensions appear to be decreasing starting from the incisal aspect towards the tooth tips. They appear to be slender. They are conical in form and show a bluntly pointed as well as sharp curve at the apical third of the root. So there is a picture of the crown showing a mesial and distal slopes, where the distal slope is longer, mesial slope is shorter. Both of them merge and result in a pointed cusp tip with a properly well developed middle lobe from the labial aspect, and a cervical line of curvature showing convexity towards the root surface, and the root showing a slender and appearing conical with a pointed root tip and showing a slight tilt towards the apical third. The crown approximately shows a pentagonal structure showing a distal longer slope and shorter mesial slope. And the labial ridge, which is usually pointed towards the cusp tip. And we also see an elevation at the junction of the middle thirds and the cervical thirds. Other than that, at the incisal thirds, we find proper depressions because of the properly raised middle lobe ridge. These depressions are being formed. Coming to the lingual aspect of the maxillary canine, the crown and the root, they appear narrow lingually when compared to that of the labial aspect, whereas the